Today I'm going to talk about the top 20 frequently asked questions about coronavirus. First, we start off with the basics. So what is a novel coronavirus? A novel coronavirus is a new coronavirus that has not been identified. The virus causing coronavirus disease 2019 is not the same as the coronaviruses that commonly circulate among humans and cause mild illness, for example, the common cold. So why is it called COVID-19? CO stands for corona, VI stands for virus, D for disease, and 19 is the year of the virus outbreak, which was in 2019. Next, we go to the how virus spread, the questions on the spread of coronavirus. So, how does the virus spread? It spreads mainly through respiratory droplets produced when the infected person coughs, sneezes, or talks. The droplets can land in the mouth or noses of the nearby people, and then they will inhale through their nose and then inhale into their lungs. Can the virus spread through take-out food? Currently, there is no evidence to support its transmission through food. So, remember to always wash your hands with soap and water for at least 20 seconds before preparing or eating food. And the next question is, will warm weather stop the virus from spreading? It is actually not known yet whether weather and temperature will affect the spread of the virus. So what is community spread? Community spread means people who have been infected with the virus in an area, and also including those who are not sure how they were infected, where they were infected. So question number 7, can mosquitoes or ticks spread COVID-19? There is actually no data yet to suggest whether this virus can spread by mosquitoes. And for now, the main way it spread is from person to person. Next, we move on to the prevention segments. Can face masks or face coverings prevent COVID-19? Yes, it is recommended to wear face masks or face coverings because they provide an extra layer to help prevent the respiratory droplets from traveling in the air and onto other people. Is it safe to get care for my other medical conditions during this time? Yes, it is very important to continue taking care of your own health and wellness. Talk to your doctor and make sure to continue your medications according to your doctor's advice. And during this pandemic, most hospitals or clinics will provide alternative management for those chronic patients, especially those who are going for dialysis or chemotherapy. Can COVID-19 spread through packages? Actually, it still remains unknown how well it spreads, and although the virus can survive on some surfaces, it is quite unlikely to spread through packages. But we should always take precautions and dispose the packages ASAP and wash your hands often. Can I donate blood? Yes, you can, but make sure you practice social distancing from others during the blood donation. Should I use soap and water or hand sanitizer to protect against COVID-19? Hand washing is still one of the best ways to protect yourself. So make sure to wash your hands often. What should I do if I get sick or someone in my house gets sick? Stay at home unless you are going out to look for the doctor to seek medical care, and use a separate room and bathroom for those members who are sick. Wash your hands often and use clean face masks to prevent spread to other members of the household. And moving on to question number 14, what should I do if I had close contact with someone who has COVID-19? Look out for symptoms. Watch out whether you have fever, coughing, shortness of breath, or other symptoms. And take your temperature often, and if you have those symptoms, seek medical help immediately. Should I make my own hand sanitizer if I can't find it in the stores? It is not encouraged to produce and use homemade hand sanitizers because you don't actually know the correct ingredients to use, and also when you make those hand sanitizers, it is not under sterile condition. And moving on to the questions asked on the signs and symptoms of COVID-19. Question number 16. How long does the signs and symptoms take to appear after infection? Symptoms may appear 2 to 14 days after exposure to the virus. When should I seek medical care? You should seek medical care if you are showing these emergency signs, like trouble in breathing, persistent pain or pressure in the chest, new confusion, or drowsiness. Are the symptoms of COVID-19 different in children than in adults? No, actually the symptoms of COVID-19 are in fact similar in both children and adults. Question number 19. Who is considered a close contact to someone with COVID-19? For COVID-19, close contact is defined as anyone who was within 6 feet of an infected person for at least 15 minutes, starting from 48 hours, around 2 days, before the person began feeling sick, until the time the patient was isolated. This is defined as a close contact. Okay, the last frequently asked question. Who is at a higher risk for serious illness from COVID-19? There is actually limited information regarding this because this disease is in fact still new. But based on the current statistics, those who are at a higher risk for serious conditions are actually older adults and people with underlying medical conditions, such as cancer or diabetes or other diseases. So that's all from me. Stay safe and stay at home. And if you like my video, do press like and hit subscribe on my channel button. I will be posting frequently, maybe every week, for videos regarding medical conditions, medical diseases, or any medical updates. See you in the next video.